Often patients come to have dental implants because they're missing teeth, their teeth are failing, they have a denture which they don't like, or they have a denture which is not very stable. Previously we've always just used either a denture or a bridge. With a denture it's removable, with a bridge you have to shave the possibly healthy teeth on either side to replace a tooth. With a dental implant now, we don't have to do that. It's often the ideal treatment for that reason. It's a bit of a long procedure, but what happens is that initially what we'll do is a patient will come to see us, we'll get them in, gather the information from them, sort of find out what sort of problems they're having, look at all the information, take a 3D scan, explain that to the patient, run them through the process of how it works. Then when everyone's happy, we then book in for the surgery. The surgery generally takes about 90 minutes in most cases, and then after that, a week later they come back and we take the stitches out, make sure everything's going okay, and then we monitor the progress of the healing for about 3 months. Often what can happen with that during that healing phase is that it'll either be a little cap sitting above the gum, or often it might just be that the gum is healed over the top of it. So for example, if they had a denture, they would be able to continue using the denture during that time. Sometimes if they're missing a tooth, we can look at either putting a temporary tooth on top of the implant or maybe even a temporary denture during that time. I think one of the things that often patients ask me is that, is it very sore? And often having a tooth out is usually more painful than having a dental implant. And the reason for that being is with the dental implant, we don't have any nerves involved like we do with the tooth there. Often we would do that under anaesthetic in the chair and it's a bit of discomfort the night of, maybe the day following, but after that it's fairly well comfortable and patients are able to get on with their day. The beauty about a dental implant is that it's a titanium screw that goes into the patient's bone. The body then heals up around that and it acts as an artificial root. And it's quite versatile. We can, on that implant, we can either put a tooth to replace just one tooth, or if we have a couple of implants, we can place more than one tooth, or in the case of a denture, we were able to put a clip on that implant which will anchor the denture into the patient's mouth and create a more stable denture for the patient to use. The beauty about having dental implants done here with us, and why a lot of patients have it done here with us, is because often the patients are quite familiar with the clinic area, so they're our patients. We don't have to travel to multiple locations. We have the experience here to deal with any sort of complications that might happen, and we always work with the patients to try and get a solution for them anyway. It's good when implants work, but it's having the expertise to be able to deal with any complications that might arise as well. We've also got a big network of dentists here who are all compassionate and all really experienced with dental implants who can look after the patients, not only before, during, but also after. Dental implants we'll see patients throughout their life, and so it needs consistent reviews as well as being able to manage that as well. So we have the latest in dental implant technology. If there's any questions that you might have or are thinking about getting the procedure done, please come in and see us. We're more than happy to have a chat and go through that with you about your specific case.